let me say the Houston Health Department is reporting 117 new cases of COVID-19 today. That's 117 new positive cases, bringing the total case count in Houston now to 5,030. We've crossed the 5,000 mark. The total number of deaths in the city of Houston has increased to 104. Yesterday was 101. Today it is now 104. So there are 3 additional persons that we are adding to our death count. Of these 104 deaths, 24 of the 104 are associated with nursing homes, and you know there's been a great deal of conversation with regards to our nursing homes. So of that 104, 24 are associated with the nursing homes. The 3 new deaths today that we're reporting are a black female in her 70s with underlying health conditions who passed away on April 26. A black female in her 70s with underlying health conditions who passed away on April the 10th, and then a white female in her 90s with underlying health conditions who passed away on May the 2nd. And as we work to save lives and stop the spread of COVID-19 in our community, many Houstonians are also coping with the reality of job losses during the public health crisis. As you know, last week, City Council passed a $15 million rental assistance program using a portion of the $404 million the city received through the CARES Act. And earlier today, well, starting last week, on Thursday, the portal opened for apartment complexes, and then earlier today, it opened up for tenants, for renters. The program administered by Baker Ripley opened at 10 a.m. this morning, remained open for about 90 minutes, and received enough applicants to exhaust the entire amount, that entire 15 million, and it was exhausted in 90 minutes. More than 11,000 renters applied today and met the pre-screening eligibility requirements. That's more than 11,000. And last week, around 6,000 landlords signed up to that part of the program. So it opened up this morning at 10. By 11:30, the entire $15 million had been exhausted. I knew going into it that the need would be greater than the amount provided. That is why last week I sent a letter urging the federal leaders to commit at least another $100 billion to rent relief and $75 billion to homeowners being foreclosed. What we dealt with today, we dealt with renters. We're hoping that Congress will do something, at least allocate $75 billion for homeowners. And Bill Kelly, who oversees the Government Affairs Department, is working directly with our congressional partners, and Bill is right there in the University of Houston bandana. Last week, Recovery Czar Marvin Odum announced a COVID-19 response plan focused on testing, access, and equity, and expanding the health department's workforce to hire an additional 300 contact tracers. Today, I'm pleased to announce the Houston Health Department is hosting 2 virtual job fairs to increase our workforce to monitor and contain COVID-19. Please bear in mind, we already have 125 contact tracers who are already working. We're seeking to add another 300. There'll be a virtual jobs fair that will be taking place this week. The Houston Together Virtual Jobs Fair. That's how we are labeling it. The Houston Together Virtual Jobs Fair on the screen will take place Thursday, May 14th at 11 a.m. and 1 p.m. on Microsoft Teams. People interested in participating should visit the City of Houston Human Resources webpage Thursday morning to find links to join the virtual events. And the job fairs will provide information on 300 new temporary positions, including how to apply. Available positions include contact tracers, call center representatives, community involvement coordinators, epidemiologists, nurses, and other roles. Houston Health Department Stephen Williams is here to discuss more about the work the contract tracers will do, especially as more people are returning to work. Director Williams.
Thank you, Mayor. Today, the mayor announced that there was 117 positive COVID cases. What that means for the Houston Health Department is that we have to contact all 117 individuals. That one contact usually results in 3 to more contacts. The whole idea of contact tracers or contact investigation is to ensure that we get an informed history of close contacts of the person that has tested positive so that we can conduct an intervention that would lead to those individuals being safe. The 300 new temporary positions that we are advertising for through our virtual job fair are critical to this contact tracing effort. The mayor said that not only is that contact tracing piece important, but we also need people to man our call centers for testing. We need community involvement coordinators that will help us to engage the community to get folks really comfortable with the idea of being contacted by the health department. This is not new for the health department. We've been doing this since the early inventions of public health, but it's never been to this scale or to this scope. We've already had a few dozen people call or contact the health department expressing interest in these contact tracer jobs or related jobs, but that's not enough. The 112, even plus the three additional 3 dozen is not enough. We need another 300 people to ensure that we're adequately following up with people who have tested positive for COVID-19. And to that end, I just want to give you a little update about our testing efforts. We've used both internal resources from the Houston Health Department and community partners to strategically guide locations to ensure equity and adequate testing penetration across Houston. Our 2 major sites, Butler and Del Mar stadiums, to date have tested more than 30,000 individuals. Our partners, United Medical Center, Memorial Medical Center, is also operating a variety of fixed sites, testing sites. Those sites are guided by geographic information received by the Houston Health Department to ensure testing penetration and equity. An added strategy is our mobile testing sites. Current mobile sites are operated by the Houston Health Department and the National Guard, sponsored by TDMS. They have been rotating throughout Houston, and we plan to cover at least 25 locations by the end of May. These sites can see anywhere from 100 to 150 people per day. And the estimated capacity between our mobile sites and our fixed sites is around 2,000 per day. We want to thank our partners, Kroger, who's going to be a future partner, United Memorial Medical Center, Spring Branch Community Health Center, Lone Star Circle of Care, El Centro de Corazon, Avenue 360 Health and Wellness Center. These are FQHCs that we have been supporting in our efforts to test. Our testing situation is fluid. We continue to modify our plans as we continue to gather information regarding testing penetration in individual zip codes and health equity.
Thank you. And the goal is to have testing all over the city, as we indicated, 24 to 25 sites, testing sites by the end of the month. And we are well on the way to doing just that. I will tell you that in the city of Houston, there are a number of people, great demand for the testing. I went and had mine done on yesterday, still waiting on the results for it. But let me encourage people to continue to be tested. And before I open for questions, I want to mention that Phase 1 of the Mayor's Office of People with Disabilities Food Access Program has ended as of last week. In collaboration with our community partners, we were able to serve nearly 3,300 Houstonians with disabilities. And the Mayor's Office with Disabilities is working with community partners to stand up a more long-term food security Phase 2 for the duration of the COVID-19 pandemic. And if you want more information, please visit www.houstontx.gov/disabilities. Before we turn directly to the question, let me bring up Tom McCaslin, Director of Housing and Community Development, to speak specifically about the Renters Program and maybe can elaborate a little bit further on what happened today.
Thank you, Mayor. As the Mayor indicated with our partner Baker Ripley, the portal for the tenant applications opened at 10 a.m. Applications were a little bit slow because of capacity for the first 30 to 45 minutes, but that real quickly got up to speed, and within the hour and a half, the first 90 minutes, all 15 million was fully allocated. Over 11,000 applicants came in, as the Mayor indicated. The total number looks like it's going to be close to 12,000, over 11,800. And prior to the opening of the portal, we know that 30,000 folks were on the website looking at the resources that were there. So we know that the need far exceeds the $15 million, which is all the more reason to push for the additional federal resources that the Mayor mentioned. Over the next 2 weeks, Baker Ripley will be confirming these applications. Within 2 weeks, the applicants will receive a pledge letter, and the goal is to have all of the funding out the door and into to the landlords on behalf of the tenants by the end of the month.
And then because we have some inclement weather coming in over the weekend, it does appear, a significant amount of rain, Chief Bunick with the Office of Emergency Management.
Great. Thank you, Mayor, for your leadership and for your guidance during this COVID responses. The Office of Emergency Management has been actively monitoring the weather along with the COVID responses for the city. Last week I was talking about hurricane preparedness week. Today I'm going to talk about a potential large storm that's going to be coming in this weekend. Right now it's expected to come in the Houston area late Saturday and early Sunday. We're expecting potentially heavy rainfall, which will likely lead to street flooding. The Office of Emergency Management has been preparing with the other city departments, the Houston Fire Department, Houston Police Department, Public Works, to ensure that we have all our high water rescue vehicles and personnel on call. So the city is prepared. We're going to be closely monitoring. I will tell people if you are out and about and you do see high water, turn around, don't drown. The Mayor's office will be providing messaging along with the Office of Emergency Management to alert Houston to keep everybody informed. Thank you, Mayor.
So please be weather aware and weather alert. And I wanted to mention that on the weekend with the weather expected rain. So if you desire to be tested, and bear in mind anybody in the city of Houston can be tested, whether you are symptomatic or asymptomatic, try to get in between now and Saturday afternoon or so. Because if the weather gets too bad, we may have to cease the testing later on Saturday into Sunday. So hopefully not. But do try to make you get your authorization code and go in and be tested. And let me tell you, it's not being tested. It's not bad at all. You either do the self swab yourself, or you just kind of lean back and close your eyes and let the other people do it. They told me, I was going to be able to do it myself, and I was real happy with that. Until they got me to the testing site and the nurse told me to lean back, she was going to do it. And she went a little bit further than I would have gone, but be that as it may, I got it done. And I feel so much better that I got it done. So the message is those very same things that work to flatten the curve are the very same things that will help us to open up and move forward. Okay? Don't change. We've been very successful at how did we flatten the curve in the city of Houston such that we are not having the same number of cases positive and the number of deaths as other major cities? What did we do differently? We started early, we shut down early, we engaged in social distancing, we put things over our mouth, and we engaged in proper hygiene. Those were the things that helped to blunt it. Since the virus is still here and we don't have a vaccine, the very same things as we start to open up that will work well, social distancing and putting on the face coverings. If you act like the virus is gone and you just come out and you're going to the parties and you're engaged in the groups and gatherings and you don't have the face coverings and you're not engaging in social distancing, the virus is going to remind you that it is still here. Where we are now, we flattened it, blunted it. Now we simply have to manage it until there's a vaccine. If we do that, then I think we can manage things successfully.
Thank you, Mayor. As the Mayor said, we are all in this together, and we will be victorious by working together. I think it is important to take note that the models that we're now operating under in Washington are 147,000 dead Americans with over 3 million cases, and now we're at 82,000 deaths. So the mayor gathered the members of Congress a few weeks ago in the backdrop of the reality that even then, that the coronavirus was not going away. We are even more definitive that the coronavirus is not going away. The tragedy is that it seems to be morphing in many instances, particularly as we are trying to discern what is happening to children. So I think the word to the wise is following what has been the framework that the city and county has used. That is to safeguard most, if not all, of its residents that are here. And I support the idea, not only from hygiene of washing your hands, but also knowing symptoms like your temperature or cough or you can't breathe. That was the earliest symptoms that we were asking people to assess, and if you couldn't breathe, call an ambulance. And now we've added, as we have learned the science and how it propels, to wear masks. And unfortunately, we're in our neighborhoods and we don't see people wearing masks. And so it is clear that as much as leadership is here, if we don't work as a team, wear our masks, and pay attention to the hygiene standards, we're not going to be able to keep it blunted. The mayor, in the meeting with members of Congress, talked about the issues that were important to the city. We listened, and we have been in conference calls, virtual meetings. We have submitted our request over the past couple of weeks. And so I think it's important to note that the next 48 hours, I expect and hope that all of the Texas delegation, Republicans and Democrats, will respond to the conference call that we had and the understanding of some of the needs of all of the cities and counties throughout the state of Texas. So we will be voting on a $3 trillion plus stimulus package, but as it relates to our cities, it will be $1 trillion coming across the nation to local, state, city, and county. And one of the things we argued for and have received is that the city will get direct payments. And we argued vigorously for it to be more than just the number of COVID-19 deaths. One death is too much, but some areas had more deaths, tragically. And we mourn those deaths. I've heard the mayor say often, one death is too much. We have people dying here every day. But our numbers, I would say, thank God, we've been working on to try to ensure that we are continuing to move forward to not have as many deaths, but it goes up and down. But it should also be based, this funding, on lost revenue. And the large events that this city, rightly so, and county, had to close or stop so that we could save lives. So there'll be $1 trillion to provide for direct payments. And this bill is called the HEROES Act. And we hope those direct payments will help with our city workers, including our municipal workers, who are essential to helping this city run. Environmentally, no one would want trash around. To our police and fire, to our healthcare workers, EMS, to our teachers, and in particular, we're adding a $200 billion to help in hazardous pay. We are aware of the loss or the infection of a Metro bus driver. Transit workers will be included in that. Many of us made a request for. We are continuing to be a partner with the city by adding a $6,000 addition for cash disbursements to families. And that will come in a variety of ways that will include the children in that family as well. And that we're going to continue the $600 unemployment that will help the mayor and those who cannot find work. Job fairs are continuing. The Texas Workforce Commission has indicated they will not be putting their job search requirement in at this time, but people are frightened. People have child care issues. Some are COVID-19 positive. We will continue paying $600 a month to those unemployed up until January 2021. We are focused on our small, tiny businesses. And so we'll add another $10 billion for our tiny businesses and for faith institutions, because we think those are mostly the ones that have been left out. And we will give you a payroll retention tax credit as well to keep those employees, maybe the restaurants who've opened up, and maybe the business is mounting in terms of takeout, which is personally what I encourage, to build up on the takeout, but I do know that people are excited about being able to be in the restaurants. To keep employees, we will be, in essence, providing more opportunity to be able to keep those employees. Mayor will be helping with your efforts, and we will be giving housing assistance to renters directly and helping people with their mortgages so that they're not foreclosed on. You will be able to get that, and we will plus up the supplemental nutrition program to help with the food insecurity. This should be a bipartisan effort. These dollars are needed now. That is why we're trying to get this done before the end of the week. And let me acknowledge and thank the team for the housing assistant, City Council. Hopefully we will supplement and reimburse you for that and help it to grow. Let me thank the Health Department, Dr. Purse and others, for immediately moving toward contact tracing. We will provide you additional dollars for that. And I hope that we'll be using our local talent to be able to be employed, because they know our neighbors, they know our neighborhoods, they know our cultural diversity, our language diversity, and I think that is very important, and we'll be providing the dollars. We're trying to work specifically to make sure that you can use local persons for the contact tracing. So, Mayor, we had the conference call, we worked, we submitted these requests. I specifically did the revenue loss. Want to make sure it is revenue loss and direct payments, and that will happen, as well as giving you the dollars that you will be able to supplement, I hope, in your budget for some of those that may be furloughed that are essential workers, and $75 billion again for testing. And I never close without saying testing sites are open. Public-private sites are open, working with UMMC and other private entities. Kroger is starting up. CVS will be coming across the nation. Del Mar and Butler open. Forest Brook, Cullen, 510 West Tidwell. Greenspoint is open, and those folk in Greenspoint, we need to see you at the Griggs Elementary School. We have testing. We might be the model for testing in the nation. We have drive-through testing and other aspects of testing. And most of our testing is across the board without appointment and is no charge. And in many instances, no pre-registration. so you can have a myriad of testing opportunities, and we hope that you will take advantage of that. Finally, let me say that we will look forward to working with the city on its issues, and we are particularly concerned, if you will, to make sure that we get these funds here as quickly as possible. And I do want to offer to council member and friend best wishes to Councilmember Plummer and all those who are now facing COVID-19. We want to make sure that you know that we're standing by you and you're not going to be alone.
Thank you, Congresswoman, and thank you all for attending. Thank you very much.